So you'll have your surgery and then you're going to be admitted to the hospital.
The hospital stay then, once you're up on the floor, you're usually on the hospital between 2 and 4 days after the surgery. Most of that depends on how mobile you are, how well your pain is controlled, how well you're tolerating a diet, etc. So I'd say our average stay is maybe 2.5 days, but it's anywhere between 2 and 4 days in the hospital before you're discharged. In the hospital, we try to get a good handle on your pain so that we know what medications to send you home with. We use a mixture of narcotic pain medications, which are very effective, and also muscle relaxants. A lot of people have spasm associated with this procedure, and so we'll find a good mix of pain medications and muscle relaxants that will help with pain, and that's what we'll send you home with. When you're in the hospital, you'll be seen by not only us every morning, somebody from our team, but also from the medical team at the hospital as well. And occasionally we'll also involve a pain management team from the pharmacy if necessary to help with pain just after the surgery is done as well. You can still have some aching and pain and popping in the hip even for a few months after this surgery. It takes a full 6 months to a year to fully recover from this. But we do take a number of measures with both muscle relaxants and pain medications around the time of surgery to help mitigate with pain.
So we have a huge team now working on this. We take great pride in providing you great care on the patient floor. And that's our goal for this, is to make this as seamless of a stay for you as possible. We do have information sheets for you in our packet. Okay, they're expectation management sheets so that you guys can see what to expect really from a pain standpoint. And from a nursing staff standpoint, we had our nursing staff put together kind of a sheet for your information so that you guys can learn about what your stay is going to be like during the hospital stay. A lot of people have a lot of stress and fear and trepidation about going home and how that transition from the hospital to home will be. So our nurses, our physical therapists, and our occupational therapists in the hospital will all work with you and teach you the transition between how to kind of survive in the hospital and how to survive when you go home, right? In terms of activities of daily living, and teaching you what you need to be doing when you go home.
All right, after the surgery, there's a lot of questions about activity level, and activities are sort of phased in over time. So the first 6 weeks after this surgery, you really have to be on crutches. You can put your foot on the floor, but no weight through your foot. We call that foot flat weight bearing. And the therapists do a really good job of teaching that in the hospital immediately after the surgery. The reason we do that is to give the tissues a chance to heal up before you start putting weight through them. So we typically have you in physical therapy once, sometimes twice a week in the beginning, but the first 6 weeks are going to be kind of boring. It's mostly physical therapy to move the hip. So motion machines, the physical therapist will move the hip manually as well. We'll have them avoid certain positions, but the main purpose of the first 6 weeks is to let the tissues all heal up and to make sure you don't get too stiff.
Around 6 weeks, we're going to be getting you on a bike, get you in a pool, let you do gentle walking in the pool, even gentle flutter kicks. Depending on how you progress, we can get you on elliptical around 8 to 10 weeks. Okay, no impact yet, but low impact type activities. And then once we get to about 3 months, we'll start ramping that up even more. For our younger patients, often they're doing incredible at this time, so we'll start even talking about a return to sports protocol over the next 4 to 6 weeks. Okay, so by 4.5 months, we're getting them back to play. For our older patients that we're doing this in, and by older I'm meaning 30 to 45, 50-ish. Okay, we're still going to be working with lower impact type stuff at this point, but we're going to be letting you do it with increased frequency to get your cardio back and to get you back in shape. And then we'll start introducing impact, anywhere between 4 and 6, sometimes a little bit longer, 4 and 6 months, but usually between 4 and 6 months, we're releasing people back to doing most of the stuff they want to do. I like to tell patients the first 3 to 4 months, you get about 60 to 70% improvement. It takes a full year to get that last 30 to 40%. So from an expectation standpoint, this is we say it's 4 to 6 months before you're getting back to doing what you want to do, and most patients are back pain free. But it can take a full year before you get all of your muscle function back and you feel really good and stable.
A lot of people ask about driving, and most people have automatic cars these days, thankfully. So if you have surgery on the right hip, it's usually around 6 weeks before you can drive, because that's when we let you put full weight on your hip. If you have surgery on the left hip, it's usually around 2 weeks, and the main reason for that is that we want you also to be off of pain medications before you drive. So the two criteria that we have are off of pain medications and fully weight bearing on the leg that you're using to drive. I always recommend that people, when they first start driving again, go into an empty parking lot, drive their car, hit the brakes in a hurry, make sure that they can hit their brakes safely and stop quickly if they need to.